when a certain person knows or feels really depressed, what is that person supposed to communicate to the psychologist or the psychiatrist that person goes to?
See, once you're in
Because
front
a
of a
lot of time,
psychologist,
if I am coming for the first
okay,
time,
okay,
I have a huge stigma that you will judge me.
okay.
You will judge me.
Not
I know
necessarily.
I'm coming there for you to judge me.
Okay.
But then I don't want to reveal everything about my life.
Okay.
Right?
See, whenever we see any client, no, there are fundamental things which we follow. First is confidentiality. You don't even have to ask for it. Whatever information you share in the clinic or you share with a doctor or a clinician, no, it's bound to be confidential. Okay. So you need to give that amount of trust to the clinician. Second thing is that being non-judgmental. Okay, it's not that if I give this piece of information, the clinician is going to judge me. No, any therapy, no, it's based on being non-judgmental. Okay, that's the basic pillar of it. Okay, and when you go out to the doctor, no, if you are able to share the information, details, whatever is bothering you, whatever changes you see in yourself in the past few weeks, so you can say it to the doctor, to the clinician. Or if you think that maybe you may miss some information or you're not sure about it, probably you can make a note before coming over here. What are the things
So
which can be discussed?
It's fine for me to just write it and give it to you if I'm not comfortable talking.
Absolutely. Okay, absolutely. The thing is that if you're not comfortable in telling, you can write it and give it to you. Or probably if you think that things may be missed, so before you visit the office, before you visit the clinic, you can make a list of symptoms, which many of the clients they do. They tend to have it something like a thought diary. Also, we always insist them to write down as to what are your thought processes are, what are the problems which you're having in the past 1 week or 2
so
weeks.
you
We
also
send them
get to
so that
go on the same journey with them.
so that even they don't tend to forget things, and we will be able to keep a tab on those things. And if you think that one of your close associate, be it a close friend or a close family member, it's better for them to accompany you so they can share some information. Even that's welcome. Even that's
and this
better.
is a big challenge, right? So I'm your best friend, say, right?
Okay.
I know you're going through an absolutely bad time.
Okay.
I think you need help.
Okay.
Is it alright for me to visit the doctor on your behalf?
You can do that provided if the person consents in that. Okay. So it's you can say that, okay, see, I really understand that I'm able to see there are certain changes in you which seems to be a problematic kind of behavior. So let's talk about it. Be supportive towards the patient. Okay, be supportive towards him. It shouldn't be that you're judging the patient or you're offending him in some way or not belittling him. Okay, be supportive towards him and try to discuss the problems with him. If you see that there are some issues which needs to be handled by a professional, discuss with him. Okay, see, these are the problems which are happening. It's better that probably we go on to take for a professional help. If the person is willing, it's well and good. If the person is not willing, at least check with him. Okay, I'm really concerned about you. I'm bothered about the things which have been bothering you. So is it possible that I can go and discuss with some professional on your behalf so that later on you can join the discussion? So you can always have a discussion with him and see what the patient has got to say about it. Okay, so healthy discussion, being non-judgmental, being supportive takes a long way.
But then I think in India everybody will judge.
Not necessarily that everyone will judge. Some of them may judge. Some of them or most of them may judge, but not necessarily everyone is going to judge you.
Right.
Nowadays, things. One positive thing is that things are changing. Even at the workplace, people are being supportive towards mental illness to some extent.
True.
There is a change, though the change is very slow. It's going to take some time, but definitely there is some kind of change which we have been seeing.
True.